Hey guys, nice to see you again. How was the last session, session 31, NTM pulmonary disease, non-tuberculous mycobacterial pulmonary disease? Was it interesting? Are you satisfied? I hope so. Today we will talk about pseudo lung nodule, pseudo pulmonary nodule on chest X-ray. Let's enjoy Dr. Y. Chest Radiology. I'm Dr. Y. Chest Radiologist, medical professor in South Korea. Let's go. Pseudopulmonary nodule. Why do we worry so much about pseudopulmonary nodule? Because we worry about the pulmonary nodule. Then why do we worry about the pulmonary nodule? Because we worry about the lung cancer. Pseudo means false, lying, fake, not true. Pseudo nodule is false nodule, not nodule. Pseudo pulmonary nodule is not true pulmonary nodule, at least not true lung cancer. It is called lung cancer mimicker. When we say the term pseudopulmonary nodule, maybe we confess that I am stupid, because it is clear. This is nodule. This can be malignant. That is the point. If there is pseudonodule, it is simple to say this is not a nodule. That's the point. We worry about the possibility of lung cancer. Pseudopulmonary nodule is not pulmonary nodule, but included in the chest radiograph. Outside the lung, which includes skin lesions such as wart, subcutaneous, bullet, calcifications, men and women's nipple, refracture callus formation, bone island, pleural nodule, thoracic spines, osteophyte, medical device such as EKG lead, accessory such as hairband or shuts button. What should we do when faced with pseudopulmonary nodule? Shakespeare told before, to be or not to be, that is the question. We, the chest radiologists, may have to say, to be nodule or not to be the nodule, that is the question. First, we have to have a suspicious mind about the possibility of nodule, possibility of malignancy, and then have to compare with previous films. If not solved, we'd better recheck another film, another same film. Still in darkness, then we have to go to CT, chest CT, possibly low-dose chest CT. To enjoy this session, don't be so serious. Just enjoy the scene, just enjoy the slides, and nod your head. That's it. Don't be serious. Let's start the scenic drive at the Canyon Valleys, the beautiful national parks. Just enjoy the slides. Let's start our Jeopardy TV show. Where is the pseudonodule? Yes, on the left. Where is it? This one. What is your answer? What is this? The answer is skin wart. This is axial contrast enhanced CT. Where is the skin wart? Do you got it? Here. This is the wart. This is it. This is the second case. Where are the abnormal findings? This one. This one. This one. This one. Please focus on this one because it looks like a pseudopulmonary nodule. Others are outside of the lung. This one. This one. This one. This one. What is your answer? The answer is skin, subcutis, muscle, cysticercosis calcification. Are you correct? This calcification, probably this calcification looked like this one, pseudo-pulmonary nodule. And this contrast enhanced XR CT shows this one, this one, this one. Cysticercosis. Third case. Where is the pseudonodule or pseudonodules on this old woman's chest radiograph? You got it? What is your answer? Are you correct? Refracture with callus formation. 1 month after this film, we found this anterior rib, linear, focal bulging rib, sclerotic densities. That's it. Callus formation of rib fracture. How about this old women's film? Let's just forget this one. Where are the false pseudonodules and what is that? What are those? Yes, correct. Multiple rib fracture with callus formation. That's correct. How about this middle-aged woman's chest radiograph? How many pseudonodules do you see? Yes, this is the answer. Callus formation after rib fracture. We see 1, 2, 3 rib fracture with callus formation. Are you correct? Where is the abnormality and what is that? What is your answer? This film is 1 year ago. Same patients. Do you see the same focus at the same location? Yes. Bone window setting XR CT. Anterior rib bone island. This one. This one. This one. Where is the abnormal finding of this middle-aged man? You got it? What is your answer? Let's check it out. Are you correct? This one? Bone island. Here it is. Please pay attention for this one and this one. First coast-chondral junction, so-called student tumor. I'll show you later more. This middle-aged man's chest radiograph is not a question for you anymore, isn't it? Yes, correct. Bone island of the rib. How about this one? What is your guessing? What is your answer? Isn't this look like lung calcification, calcified granuloma? Maybe or maybe not. What is your answer? Let's check it out. How do you feel now? This bone setting XR CT shows the scapular lesion, pseudo lesion, bone island. Isn't this interesting? Please look carefully. This middle-aged man's chest radiograph. Where is the abnormality? Watch closely and slowly. You got it? Where is it? What is that? We get the answer here. osteochondroma, right second rib. This one. This somewhat hilar density. We see the sign here. Hilar overlay sign, not hilum, overlapped with the hilar density. This is osteochondroma of the rib. What's unusual for this middle-aged woman? Just forget this one. This is endoscopic surgery for the early gastric cancer. What is unusual? Okay, you got it? Or you got them? These are the answers. Both nipple of women. What shall we do if we see only one nodular density here in this middle-aged woman, not like previous women with both nodules? What shall we do? Yes, that's it. Comparison with the previous film. 1 year ago, there are another nodular density here on right side and left side. Yes. What are these? Yes, they were nipples. Nipples, normal nipples. She doesn't have any abnormal findings in the lung. No pulmonary abnormality at chest CT. Sometimes we meet same both lower lung field and nodular densities in the man, not in the woman. What are these? Yes. Yes, you are correct. These are both men's nipples. We sometimes meet these nodular densities even in the man. His 10 years old film also shows 2 nodular densities in the both lower lung field. Both are nipples. What do you see with this middle-aged man's chest radiograph? What is abnormal for you? How about aortic line or paraspinal stripe? Yes, correct. That's the point. That's abnormal looking. What is that? 5 years ago, it was there too. Same size, same findings. What is that? Is that posterior mediastinal tumor? Paravertebral compartment tumor such as neurogenic tumor? Let's check it out. This coronal CT of bone setting image shows the answer. Yes, it's the hypertrophic spur of thoracic spine. What do you see? What is the abnormal findings in this film? This P-erect chest radiograph. You got it? How large? 2 centimeters, yes. This axial bone setting CT shows the answer. There is a 2 centimeter well-defined ovoid nodule with calcifications. Pleural calcifications, probably due to tuberculous pleurage. For me, I think pleural region shouldn't be considered as pseudo nodule. It is true nodule, I suggest. Next has no radiographs because I think EKG leads and shots button are no more pseudo nodules because the radiographic image quality of today is so excellent. It is not considered as pseudo nodule, just not nodule, nothing. This is a young woman's chest radiograph. She has nothing abnormal, no symptoms. What do we see? Yes, we see about 4 centimeter density left apex or posterior superior mediastinum or paravertebral mediastinal compartment, which is continuous to the neck outside of the thorax. Do you happen to remember the cervicothoracic sign described by Dr. Benjamin Farson? It was like that. Neck mass, neck pathology is usually overlying on the neck, cervical, and the thorax. That's cervicothoracic sign. That's not intrathoracic lesion. That's neck lesion. That's cervicothoracic sign. So this is not thoracic problem, and even she is very young, don't have the chance for lung cancer. And also we don't see her left aortic arch. She has right-sided aortic arch. Her last years, another film shows the hair braids going up than today's image. She has her hair and hair braids. That's cervicothoracic sign. This is another young woman's chest radiograph showing cervicothoracic sign of hair braids. In this film, which focus attracts your eyes? Which focus attracts your eyes? What is your answer? This one, right side, first costochondral junction, hypertrophic spur of hair showed high density, nodule-like density here. But in his left side, it's not like that. It's not like that. This right side is more hypertrophied than left side. Sometimes this mimics lung nodule, lung cancer. The origin came like this. A naive medical student said to the radiology professor, "Sir, that is a tumor. There is a tumor." So the teacher said, "That's student tumor, not a real tumor." Isn't this interesting? Look at this. Another student tumor of old women. It looks like real nodule, isn't it? How about this old man's chest radiograph? Is that on the right upper lung zone another student tumor? On the CT, there is a real, true tumor, squamous cell carcinoma of right upper lobe. The mass was just overlapped with student tumor, first costochondral junction. This is a true tumor. What is abnormal looking for your eyes? Yes, that is below the right heart border, above the right diaphragm. What is that? Yes, it's the prominent extrapericardial fat, usually seen in the old women, middle-aged women. And also, pericardial cyst may show the same findings on the chest radiograph. This is the last slide of the images. Did you enjoy the scenic drive? Congratulations for your effort and your success. Now you are the maestro of the lung nodule and the pseudo nodules on the chest radiograph. Congratulations again. Like, subscribe will make your next session wonderfully, beautifully by Dr. Y. Thank you very much. Have a good day.